Hello, everyone. Welcome back to Pain Points. I'm Dr. Jake Caylor, based here out of Austin, Texas at Pain Specialists of America. I specialize in interventional pain as well as advanced therapies and cancer pain management. And today we're going to be talking about peripheral neuropathy and walking on ice and fire. And that's not that's really how it's described to me quite frequently. Pins and needles, walking on fire. This is a terrible, debilitating disease. So we're going to be talking about why it happens, how it happens, the whole pathogenesis of it, and then what treatment options are out there as well. We'll be going through it from start to finish today. So thanks again for joining me. Pain Points was really born out of this need here in Austin, Texas for advocacy and outreach for our patients, really explaining not just what we're going to be doing, but why we're going to be doing it, how the disease actually developed in the first place, what things we can do to change our risk factors as well. So all of these are important things as we explore this. This is an interactive talk. So as always, if you have questions, if you want to leave a comment or question afterwards on the Facebook or YouTube page, that's totally fine as well, and I'll get to them. But as always, thanks for joining me. Our goal is advocacy and outreach for our patients for therapy awareness. So let's go ahead and start by thinking about what we're going to be talking about today. So we're going to start with what is neuropathy? How does it develop? And how do we diagnose it? Is it just a group of symptoms? And then some treatment options, because it's different for everyone. So what is neuropathy? On the right here, we see the nervous system, and we actually see it in a couple of different presentations. But I thought this picture was interesting because while the nervous system, the nerves that are there that connect our brain and spinal cord to the rest of our body, they're all there. It's a different experience for everyone. And there's different types of nervous systems, even within our global nervous system, right? We have the autonomic nervous system, we have the somatic nervous system, and constantly the job of the nervous system, and that here is all these little yellow nerves, that's to bring information from the outside world to our brain, and then information from our brain to the outside world. And that allows us to see something, react to it, and make a change to our body. And that can be with things like movement. That can be things like changing the amount of blood flow that goes a certain direction, or it can be with things like sweating, for example. All of these are examples of our nervous system working. So what is neuropathy? Neuropathy, at its most basic root, is damage to the regulatory parameters that define the inflow and the outflow of information that goes to our brain. And let me say that again. Neuropathy at its core is damage to the very structure that brings and regulates information to and from the rest of the body. And that's one of the things that's so critical to understand about it, because when we think about neuropathy as a whole, we think about all these different treatment options, what it feels like, the sensations of neuropathy. But it's important to know that nerve damage is really at the root of that. And there's a lot of ways to damage nerves. And we'll go through that and talk about that as we continue on. So when we think about neuropathy, as clinicians, we're always thinking about what type of neuropathy. Because there's not just one type, obviously, there's many different types. And so when there's many different types of neuropathy, we have to kind of put ourselves into a pattern recognition mode where we say, all right, this is a neuropathy or a neuritis, an irritation of a nerve that's consistent with a nerve root being pinched. Well, we would expect that to be in one nerve root distribution, and we could follow that nerve root distribution, like the L4 nerve, for example, or the L5 nerve. These are very commonly known as the sciatica type pains that we have shooting down in a nerve distribution. But neuropathy, if you have diabetic neuropathy, for example, might affect you differently. This would be a polyneuropathy, multiple nerves in a stocking glove distribution. So there's all these different types of patterns that us as clinicians have to be thinking about when we're trying to figure out, is this neuropathy? That's the first question. And second question, what type of neuropathy is this, or could this be? Because that dictates where we go from both a diagnostic as well as a treatment pathway. When we think about nerve damage and really how these things happen, it's important to remember that nerves are actually quite delicate structures. And we've talked about this, and I know I promised over and over again, we're not going to go back to pain pathways. We're not going to go back to, one neuron sending a signal to another neuron, and that neuron talking to this other neuron, sending a signal to your brain. I promise we're not going to go down that pathway, and we're not today. But I really want to focus on how delicate this very vital structure is. And here's a neuron with a cell body that then has these projections that go off to deliver the nerve impulse, and that goes along the axon. And in some nerves, they have myelin, and some nerves are not myelinated. And what this means is they have this type of protective coating, and it's not really protective, but it helps with the nerve speed the actual conduction of electricity down. So these nerves, all of these nerves in our body have many axons that go from one place to another. And these axons are very sensitive because all of the meat, all of the good stuff, the protective stuff of the cells, well, that's all in the cell body. So you have these very delicate axons. And these axons still need things like oxygen. They still need to have a normal amount of kind of other chemicals around them. And certain elements of high chemicals, like alcohol, for example, can damage them, or glucose in the form of diabetes, so it's sugar, can damage these things. So these axons are very sensitive to damage, and when they're damaged or partially damaged, they start to send the wrong signal. And this happens because the resting potential, and what that means is if you have damage to a nerve, it's like having a shorted wire, right? That wire can send a signal, it can spark if you move it in just the wrong way. Well, same thing here. The slightest spark here can send a signal that shouldn't be there. And our brain can interpret that in a number of different ways. So there's a number of different ways to damage a nerve. And over time, these different ways of damaging nerves build up, and the patient can experience a neuropathy or a painful sensation that's different, really. The experience is different for every patient. So to talk about this, I said I wasn't going to talk about pathways, but for example, on the top here, we see a guy that sees a glass of water. So that's a visual input that's going to our brain. Our brain processes that information, and then out from that brain comes this signal that we're going to pick up the glass of water and we're going to take a drink. Well, this is constantly happening over and over again in our bodies, whether we're aware of it or not. We're constantly getting sensory information into our brain that we're acting upon. And our brain has to regulate what information it accepts and how it processes that information, and then what information it acts upon. And at its root, neuropathy is a disorder of this, our body's ability to control the signals that come to it, and those bad signals getting through. Bad is really the wrong word, but the disordered signals that are getting through and how they're interpreted lead to that painful, uncomfortable neuropathy. And so what might start out as a nerve, for example, let's take a nociceptor, a nerve that's supposed to experience pain. Here's a finger that's going to be touching a candle, right? In any one of this would be a painful thing. If we touch this flame, then that would cause a pain signal that goes to our brain. Well, what if that pain nerve, that single pain nerve that's supposed to send the signal to the brain, what if there were no candle? What if all of a sudden that nerve were damaged and it still sent a signal to the brain? Your brain would interpret it as pain, but there's no candle. And that's the importance of neuropathy, is not just that nerves are being damaged, it's which nerves. And it's the pain fiber nerves being damaged that leads to this really challenging, complex experience of neuropathy. And that's one of the things that I think is the most important takeaway here, is that you may have changes in the sensory experience. Your sensory nerves are going to be damaged before your motor nerves. And so that can lead to this situation where you have all these signals that are going to your brain that are saying pain, but you're still able to move around. And that's because there's differential or uneven damage to different nervous system groups. And this is actually what our brain kind of sees. We get to see all these random little firings, and our brain has to interpret this. And if you've ever seen one of those old tube TVs, this is exactly what you see, is that static. Or if you've heard the radio and heard that static, that's what our brain is getting. And our brain is interpreting that as numbness, tingling, burning, fire. All of these things are really, really critical. I can't look at the screen anymore, so we're moving on. But this is to highlight what neuropathy really is at the most basic level. So what are some symptoms of neuropathy? And here you can see someone that's about to step on some tacks. And that really is what it's described to me all the time as. I feel like I'm walking on tacks. I feel like I'm walking on a bed of nails. It can be numbness, and not just numb, painful numb, uncomfortable numb. It's not a pleasant numbness where you can't feel it. It can be burning. It can be tingling. You have that sensation of ants crawling on you. It can be problems with balance. These are signs of neuropathy. Pain with hot or cold that shouldn't be hot or cold. So you put your hand in just some water and it's a little bit cool. That can be painful with neuropathy. Pain with even light touch. These are all things that we see with neuropathy. Now, why is it that these neurons can become damaged? Well, while we like to think of a neuron as essentially an electrical cord bringing a signal from one space to another, in reality, the architecture that goes into supporting that cord, like a nerve, the median nerve, for example, that's the old carpal tunnel nerve, goes from my neck. That nerve goes down into my hand, into my thumb, and my first couple fingers. So that nerve is a big old nerve that has all of this stuff packed inside of it. It has some cells, it has its own blood supply, it has some fat, and it's got this sheath that's wrapped all the way around it. Well, this thing is really sensitive to things like damage, compression. It can be sensitive to toxic materials such as alcohol or glucose, for example. It can be affected by things like infections. All of these things can lead to neuropathy. So at any point, all of these very, very sensitive structures we think are packaged so neatly in this cord that goes from our head to our arm, but in reality is very, very exposed and vulnerable to all of the acts of daily living that we undergo. So when we think about what actually causes neuropathy, I want to go through a couple. The first and most common is toxic causes, and these would be our toxic metabolic reasons for neuropathy. And this can be things like glucose, like I said earlier, alcohol, which I've said earlier. It can also be things like vitamins. And I get patients all the time that say, "Oh, don't worry, I take my vitamins." I'm like, no. It can be too much vitamins. It's not just not having enough vitamins. You can also have neuropathy from taking too many of the wrong type of vitamins. It can be heavy metals. It can be a number of other toxic exposures or metabolic exposures. These are all really, really important things to think about here. Physical injury. Now, we all know about the nerve compression. You get a pinched nerve in your back, it causes pain down the leg, but it can be other injuries. There are traction injuries from head and shoulder separation. There are a number of other things like compression injury, such as carpal tunnel, chronic compression of the median nerve. It's extremely painful. I have it. There's a number of other different types of physical injury. The nerve can be cut. So we have to think about all of these things when we think about neuropathic pain. Not just which nerve, but what nerves and what distribution in terms of figuring out where we're going to go. Infection. And this isn't just having like skin infections or bacterial infections, but chronic infections are also associated with neuropathy, specifically things like HIV or hepatitis, for example. There's a number of other things that go into it from a chronic infection standpoint that cause damage to the nerves. And it's not just the infection itself, it's also the treatment of those infections. Things like antivirals, antibiotics can cause neuropathy. We always have to think about patients that have malignancy or cancer being on chemotherapy. Chemotherapy-induced neuropathy being extremely painful. And next, we would talk about our hereditary neuropathies that run in families. And lastly, our autoimmune and inflammatory neuropathies. And these are really where the body starts to attack its own nervous structure. And we see this not infrequently as well. So when you think about all these signs or all these different types of causes of nerve damage, when I see a patient, I'm trying to figure out where is the pain starting? Where is it going? What are the associated symptoms like numbness, tingling, burning? What's the distribution? Is it in one arm? Is it in both arms? Is it both feet? Is it just the toes? What other symptoms are associated with it? What's the patient history? What have you been exposed to? What could account for this? Do you have diabetes? Do you drink, a fifth of alcohol a night? All of these things are really, really critical in figuring out where are we going here? And they also guide the workup in terms of figuring out what do I need to do as a physician? And when I send you for a whole battery of tests, it's not because I want to have them go draw a pint of blood off of you and spend all your money getting these tests. It's because some of these things are reversible, or we can prevent them from getting worse. All of that is really, really important. So diagnosing neuropathy takes a number of things. Like I said before, the patient history is critical. What you tell us is important. The labs we order, genetic tests, nerve conduction studies, nerve biopsies, as well as autonomic testing, looking at sweating and temperature of the skin, and then something called quantitative sensory testing, which is another way of actually trying to look at the nervous system and how it's functioning. So when we diagnose neuropathy, we want to try to be able to put this in a particular bucket to say, okay, I don't need autonomic testing or quantitative sensory testing, but I do need some lab tests and then maybe a nerve conduction study. These things are really, really helpful for us in terms of figuring out what type of neuropathy it is so we can dictate or figure out what treatment would be best. So when we talk about treatment for neuropathy, I think the most important thing is optimizing the underlying disease. And that means if it's diabetes, for example, we want to get the blood sugar under the best control possible. Why? Because the more sugar that's around, the more damage that's going to occur to the myelin, the more damage and vascular damage that's going to occur to those little blood vessels that are supplying the nerves. That's really important. So we optimize the underlying disease. Okay, well, what's next, Jake? Like, what are we going to do after that? And topical medications actually can be quite helpful. There's a number of over-the-counter things, such as Voltaren gel or lidocaine creams or ointments. And these numbing medications and things like capsaicin can be really, really helpful from a topical perspective when you can do it over the counter. So and that's reasonable. And these different gels or creams can get patients by, and you can actually survive very well with lifestyle modifications for some patients. If pain is persistent and systematic, then you can consider trying actually some oral medications. And there's a number of different medications out there, and you should discuss with your doctor which ones would be best for you to be on. But in general, the best approach is you have a neuropathy, which is likely developed from multiple different insults, multiple different things causing it, and thus should be treated with multiple different pain relieving medications. And these are specifically nerve pain relieving medications. So these are generally the classes of things like antidepressants, gabapentinoids, or calcium channel blockers. There can be numbing agents as well. And so oftentimes we want to think about multiple different ways to treat pain that's really focused on the nerve. And patients always tell me, well, none of those are real pain medicines. Well, yes, they are, because that's the mechanism that nerve sends a signal. Those nerves send signal through things like calcium channels, sodium channels, and it's really, really important to identify a drug that's going to act upon the mechanism of a nerve. After that, when we look beyond oral medications, and here's an example of some oral medications. Let's say we've tried some gabapentin or some pregabalin, some Cymbalta, duloxetine, and we're just really not getting to where we need to go. That's when we can talk about maybe doing a topical capsaicin. And you can get over-the-counter topical capsaicin, but you can also get prescription strength capsaicin. And what this is, we call it the spicy patch, but the spicy patch is essentially this 8% capsaicin that really causes this very intense burning, or it's like the spicy pepper burning of the nerves, where they get overloaded and they actually can get long-term pain relief from a simple patch that goes on. So this is generally in the form of the Qutenza brand therapy, but that's very, very helpful for patients as well. And lastly, one of the last treatment options we have is spinal cord stimulation for a patient. And spinal cord stimulation can be beneficial because, like I said before, the nervous system is this exchange between what's in our head and the outside world. Well, that all has to go through the spinal cord, which is really the electrical superhighway for all that information. So we can utilize special wires to reprogram that. And I've talked ad nauseum about spinal cord stimulation, so I won't go into it. But it is part of our treatment algorithm for neuropathy. And we've had some wonderful results with patients with it. And it is evidence-based. There's good evidence for it too. So all of these things really should be taken together. And when we think about patients with severe neuropathy, uh, as a clinician, I'm meeting that patient and then trying to enact multiple plans at once because it can be quite debilitating. And in general, it's going to need a number of different therapies to be able to target it. But at the end of the day, optimizing the underlying disease is super important in order to prevent progression of that neuropathy. So take home points. While nerve injury can improve, neuropathy tends to be progressive. And that's really that when I talk about that critical point of preventing further damage, that's really, really important. Um, Utilizing a combination of therapy usually gives the best opportunity for relief. And that's why when patients come in and say, oh, that drug didn't work. No, but we can't just do one. We have to do multiple because there's multiple points of damage to your nerve. This is a this is a disordered system that's sending all these signals that it's not supposed to. In order to combat it, we really need to get that under control. The key problem is a disorder in nerve signaling due to nerve damage. And that's the important thing to remember at the basis. We have nerve damage, and nerve damage is oftentimes not reversible. And because of that, we need to think of multiple different strategies to be able to combat the signals that are going to the brain so that we can offer the patient pain relief. And as always, whether this is you, whether this is your loved one, it's important to have a conversation with your doctor and make sure the proper workup has been completed. The number of times that I've seen patients that just say, oh, I just got my neuropathy. I'm like, well, what's your neuropathy from? Oh, I don't know. Has anyone ever worked it up? No. It's just my neuropathy. It's just the way it is. No, I actually think it's the opposite. It's important to do a workup and figure out what the neuropathy is from because we don't want it to get worse. And we want to get some agents on board that are going to be able to at least take care of the pain or tone it down so that you can function. I'll take any questions that you have at this time. Otherwise, I'll see you guys next week at 12:30. Next week, we will be talking about peripheral nerve stimulation as a branch off of our neuropathy and neuralgia kick that we've been on today. And we want to try to figure out other options for patients in terms of chronic pain syndromes. So like spinal cord stimulation, peripheral nerve stimulation is an awesome thing to be able to offer patients. And I'm really excited to talk to you guys about it next week. Join us every day at 12 or every Thursday at 12:30. Leave a comment on our Facebook, leave a comment on our YouTube, and I'll get to it. Otherwise, thank you guys so much, and we'll talk to you later.